It's close to $1 trillion in Medicaid, about 900 billion, I think, right now, for about 72 million people, as was just said. It's really shows the failure of Obamacare. And Obamacare is so expensive. A family has to pay about $24,000 to be covered under Obamacare. You can't afford it.
What? As soon as I heard him say those words, I thought, we have another pundit, another Republican pundit who has no idea what they're talking about. Obamacare is not an insurance plan, and I think it's worthwhile to take a deep dive into this CNN news piece and make sure we get the facts and the real information about what we are doing with our health care and maybe what we should do. I'll meet you on the other side. Let's just start right here. Obamacare was passed in 2010. Right now it's 2025. That's 15 years ago. Obamacare had a slow phase in. It was fully phased in by about 2014. But that means that we've had Obamacare in place for about a decade. We've needed revisions since then. Obamacare is not a health care plan, like this gentleman said. I don't know if Medicaid is really close to $1 trillion. It might be nationally because the states pay 50%. We're not going to dig into the budget right now, but this is the thing. We're so close to having Medicare for all. The fact that he's arguing against it and essentially saying Americans should give up health care to essentially afford a tax break for the rich is crazy. In fact, right now, nearly 70% of all healthcare costs are run through the federal government. This includes the list above: Medicare, Medicaid, VA, government employee benefits, tax credits, which we'll talk about that with Obamacare in just a minute, tax deductions. All of this is supported by government sources. We are so close to Medicare for all, it's crazy. And it's also crazy that a family, like he described, which we'll listen to again, is paying $24,000 a year for their health care. And that's probably just their health insurance premium. It doesn't include the out-of-pocket expenses like deductibles, co-pays, paying for your prescription, whatever it might be. And that healthcare plan doesn't probably cover eye care and dental, which are also expenses that families have to pay for with their healthcare. Let's jump back into that video clip and see what else he has to say.
Really shows the failure of Obamacare. And Obamacare is so expensive. A family has to pay about $24,000 to be covered under Obamacare. You can't afford it. So all this thing about Obama is going to solve the healthcare problem. Everybody's moved over to Medicaid. It's moving towards socialized medicine for the entire country. That's the problem. And that's what they're trying to figure out how to fix. And when you have working age males that are, on Medicaid, that's a real problem when you have 4% unemployment. So we have a pretty full employment economy. Wages are not as high as they need to be. A lot of that has to do with immigration problems and outsourcing of jobs. So there's a whole gamut of issues around this. But when you have that many people that can work and pay, there needs to be something that needs to be done on the healthcare cost side of things. And that's a really hard problem.
OMG. There's so much there. I don't even know how to unpack it. But let's start with the family paying $24,000 a year and Obamacare and his perceived failure of Obamacare. What Obamacare did was ensure that Americans could have health insurance or access to health insurance. If you had qualifying income, you would receive tax credits to help you pay the premium. Chances are the family that he just mentioned does not have access to those tax credits because they make too much money. Now, under Joe Biden and during COVID, they increased the amount of tax credits you could receive based on certain income allotments, but not all families qualify for it. Obamacare is not an insurance plan. Obamacare, or I should say the Affordable Care Act, offers greater access to health insurance. The thing that Obamacare did not do, and the reason why it shouldn't have been called the Affordable Care Act, it certainly made health insurance more affordable for certain people, but it didn't make health insurance more affordable. You see, those tax credits helped people be able to afford their health insurance premiums, but in Obamacare and the Affordable Care Act, nothing was done to actually reduce the cost of health care, to make health care more affordable at the clinic level, at the hospital level, pharmaceuticals, any of it. None of it. It didn't do anything to make it more affordable. Now, what Obamacare did do was ensure that rural areas got more access to health care. So there were dollars allocated to build clinics in rural areas and make sure that there was better access. They also put together dollars to help educate people in the healthcare field so that there were more people that people could see when they needed healthcare, but nothing was actually done to curb the profit in healthcare. Now, another thing that the Affordable Care Act did was say that insurance companies were limited to a 20% expense ratio. What that essentially means is 80% of the premiums they take in needed to go to cost of healthcare, and the other 20% was for that insurance company to operate. Essentially pay their employees, pay their agents' commissions, support the building that they're in, all of that. It's also important to note that most other nations of the world have somewhere between maybe a 10 and a 5% expense ratio. Allocating 20% allowed quite a bit, but there was no caps on how much they could eventually charge. And I'll also say this. The Affordable Care Act pointed a lot of the blame and the problem on the insurance companies, but it did nothing to remove the profit from them. And as a result, we're now 15 years later without one more piece of legislation designed to help put this together. And instead of this gentleman on the news talking about ways that we could fix this, he just wants to kick people off of health insurance. Now, are some of the people covered under Medicaid perfectly capable to go out and work? Sure. Yes, some of them are working, but they might be working at a place like McDonald's who will only give them 31 hours a week, because to get 32 means you get benefits. Are you following me? So we've got a number of things working against the American people in the area of healthcare. There's too much profit in it, and employers have no incentive to make sure that people are covered. One thing that the Affordable Care Act did as well, that actually got stripped out due to the Republicans, is forcing everyone to participate. You see, that young man that he was just describing who sits in a basement and doesn't work, I don't know if he exists or not. I hear that they do. I don't know. Most of them, I don't think, care to get on Medicaid, because most young men are healthy enough to not worry about it. But I digress. The vast majority of people who are covered under Medicaid have no other solution for their health care. These aren't people trying to rip off the system. These are people trying to get by. And instead of offering some solution, they're further shamed about not doing enough. But let's jump back in and hear what else they have to say.
People off Medicaid first, and then you figure out the rest later. I mean, I think that's the issue, is that you kick them off and then what?
Well, I don't think
this
that's
is
what they were
about,
saying.
I just want to remind people, we're talking about healthcare here.
Yeah.
So access to medical care for people. A lot of them are children. A lot of them are elderly. All of them are poor, virtually. So what then? I mean, you're saying basically to fix the affordability problem, we have to fix the healthcare problem. There's no attempt to do that. I just don't see how this works out.
It wasn't about kicking people off. It's, as it was said, it was about creating some work requirements that people can't just sit around, working age, fully able people, and just collect Medicaid and benefits. I mean, we've got to get off of that, medicine that's been out there for a long time.
What about the job seekers? What about the people who are looking for work? As you mentioned, we're in a near full employment economy right now. Wisconsin has had historically high employment for the last several years now. So there are people who still are in need of health care but cannot find a job. The unfortunate reality is that with health care being tied to a person's employment, when you lose that job, you've lost your health care. Yeah. What else can you rely on?
The whole system's broken.
Well, the whole system. And I have been a long proponent of universal health care system, which would solve all of our problems, to be quite honest. And I don't know a whole bunch of arguments against it. If you look at the amount of money that people would be saving, consumers, that would ultimately be bankrolled by raising taxes on the wealthy, as you mentioned. Thank you for that point. And what Josh Hawley also has advocated for.
Well, raising taxes on the wealthy isn't going to pay for any of this type of thing. I mean, there's just not enough wealthy people to pay for everything.
Sometimes, honestly, I don't know. Yes, there's more than enough money. We are in the richest nation of the world. If every other country out there has found a way to be able to give their citizens access to health care, you think we might be able to figure it out? This is ridiculous. And honestly, people need to stop listening to people like him. And this is the other thing that I think, because I've been watching this round table discussion with Abby Phillip lately on CNN. And many of the Republican pundits that are on here simply spew out misinformation. Some of it is like repeated lies, and you know it. But I think this gentleman might actually believe this. There's so many lies, and we need to stop listening to it. And this is the other thing. Even if you don't know if there's a way, when there's a will to do it, there is a way. These lies are created by wealthy business owners who do not want to really take care of the people. Now, that's not all of them, but that's enough of them to make this problem that we have suffered through for quite literally decades. And it will not get better until they seriously come to the table and discuss it. It's fascinating to me that he sits there and he says it's a very broken system, but all he wants to do is kick people off, claiming that people are lazy. Please stop. Stop blaming it on brown people and lazy people and trans people. Stop blaming people. Start caring enough about people to figure out a way to help take care of them. At least that's what I'd like to see. I don't know about you, but that's what I would like to see. And honestly, I think there's enough of us who'd rather see this, the caring for people and helping people, than not. Before we jump back in, I want to share with you two stories. One of them's this. A friend of mine just lost her job. She was scheduled for surgery. She doesn't know if she can afford her COBRA extension, because if you're not familiar with it, federal law requires that employers allow employees to pay their premium to continue on the health plan. It's supposed to fill a gap when people are between jobs, just like this gentleman described. But because my friend doesn't know if she can afford her COBRA premium, she canceled her surgery. This wouldn't even be an issue in a world of universal health care. And by the way, it wouldn't be an issue for the employer either, because my son, as an example, he lives up in Canada. His first job up there, he paid $50 a month for supplementary insurance, $50 a month. This gave him dental and vision and life insurance, disability, $50 a month, because the universal health care up there covers the bulk of it. And when my son decided that he wanted to start his own business, he didn't need to worry about the health insurance component. I have a niece who would love to stay home with her children, and her rationale is, I need the health insurance. These are not the reasons people should be making choices that aren't better for our families and aren't better for our economy. Small business owners and parents should be more liberated in making choices that are good for them. But now I'm just lecturing. So let's get back to the video.
I guess what Holly is also suggesting, and you can jump in on this, I mean, is essentially that Republicans want to give a lot of tax giveaways in this bill. Some of them are new, some of them are existing tax law. And they want to do that by paying for it, by cutting benefits for poor people. That's how he laid it out. Okay? If I don't see how if you're one of those poor people and you work really hard at a McDonald's and they're not providing health insurance and you have nowhere else to turn, you're paying your taxes. How do you not see this as sort of, robbing Peter to pay Paul, essentially?
Right? I just don't even understand it. It's almost as if they don't realize that these are people who are doing the best job that they can. And this is the other thing. We're not all created equal. And there is such a thing as sexism and racism. So as a result, we aren't all offered the same access to opportunity. But let's get back to the discussion.
I've heard these complaints about Obamacare now from Republicans since Obamacare passed. And you had the opportunity to get rid of Obamacare and replace it with something else. And all I've heard about is, repeal and replace, repeal and replace. You haven't repealed it because you have nothing to replace it with. So let's start with that premise. Second, you're absolutely right. What this is attempting to do is to take away health care from millions upon millions of Americans. And then you're going to say, well, we'll figure it out later. Because that's effectively what you're suggesting. You're blaming this on Obamacare. You're blaming this on a whole host of issues that you're in charge of everything now. You're in charge of the executive branch. You're in charge of both.
Days.
Not just 100 days. You were in charge under Donald Trump, right? The first time around. What did you do? You couldn't do it. And you didn't do it because you had
60 votes. I mean, John McCain voted against it.
You know what? You can blame John McCain all you want, but the reality is you could have gotten rid of it, but you had no plan to replace it with. And all of those people would have been thrown off of Obamacare, including Josh Hawley's state, which expanded Medicare under Obamacare. So you can talk about it all you want. Where's your plan?
It is so fascinating. I mean, he has been very consistent over the last few weeks in raising the alarm about this. And he's right. About 44% of all the people enrolled in Medicaid are living in congressional districts that are represented by Republicans. It's 36.8 million people. Millions will be affected by this, no question.
This is so very true. Many of the red states don't even pay their 50% share of Medicaid because they can't afford it. They have too many residents and not enough tax dollars to support what they're supposed to pay, which is 50% of the cost of Medicaid. So the blue states help support this through the federal government. And the blue states tend to pay more of the federal income taxes. This is not good on the Republican plan.
They're going to get the results that they're hoping for. But force people to work, or say you're going to force people to work, kick them off the program. Will it produce more jobs for people?
Right, Abby. So Senator Hawley is part of this faction of the Republican Party that wants the party to be a more working class party. And so that's why you get the criticism from there. And the theory here is that the GOP can save some money in the gigantic budget bill. There are a lot of spending items in there, and they want to claw some revenue back. They can save some money by adding work requirements to Medicaid.
By the way, the spending items, defense, and Department of Homeland Security on kicking immigrants out. I don't know about you, but I'd rather have my dollars go to health care. I prefer USAID. I like safe flying. The FAA. Yeah, that'd be good. I kind of prefer that over rounding up beautiful brown people and sending them to detention camps illegally. Back to the video.
I think there's a view out there in the country that maybe a lot of people are not working and getting Medicaid, and that's not popular. Actually, that's not really true. About 70 million Americans are covered by Medicaid. And according to the CBO, at least, by 2034, this bill would take health insurance away from 8 million people. So you can see from the math there that maybe 10% of the people currently covered by Medicaid are working age adults who are not in work. So the amount of money saved by adding work requirements is actually relatively small. And, that's the theory, but then in practice, there's a kind of real world experiment, because the state of Arkansas put work requirements on Medicaid a couple of years ago, did this experiment. And what they found actually is the employment rate didn't go up much, but quite a few people lost their health care.
And how many of those working age adults are women with children at home? Who then what? They're supposed to try to pay for childcare, working at Walmart or Costco. Seriously, seriously, seriously. And many of these are in red states where they want to take away this woman's right to choose whether she has a baby or not. And yet they're not willing to give the person health care and other things so that she might feel comfortable having a child and caring for a child. Back to the video, because I got to tell you what's coming up. I like.
Is Josh Hawley right that this is not the bargain that they voted for when they put Trump into the White House?
I'm 100% with Hawley on this. I think that they should be leaving this stuff alone and raising taxes on the rich. I think that's totally consistent with what the president promised the American people.
I can't even believe myself. I don't know if you have ever watched her on anything. I don't know. But she's usually just a mega Trumper and says some of the craziest things. I might do a video where she's doing some of the crazy. But this, mind-blowing. Is there hope for the Republican Party to finally get rid of this Trump nonsense, maybe a little bit of the hate, and just get on board with some common sense ideas? What? If you think so, jot it down in the comments, because I'd love to know what you think. Is there hope for the Republican Party? Back to the viewing.
People, it's why people voted for him, to represent working class people, and it's unbelievably popular. And Trump likes popular things. So I think Hawley is 100% correct on this, and he is the future of the Republican Party. This is a working class party at this point, and he knows it.
How?
And that brings us full circle, all the way around in that CNN piece. I'll note it down in the description, the doobly-doo, so that you may access it. But I'd love to know what you'd think. And if you like this content, I would love it if you subscribed. And if you like this video, it'll get out to more people. This is one of my first videos specific to healthcare, but I will put on the end screen a couple of my other videos about the debt and the deficit. Got it wrong. We can afford a whole lot more for the American people. And I'll see you there.